I'm Dr. Kevin St. Clair. In the following discussion, we'll be going over some of the features of a very common rash that affects primarily young adults called Pityriasis Rosea. We hope you find the following information useful. Pityriasis Rosea loosely means pink rash. Well, what is Pityriasis Rosea? This is a common rash that affects primarily young adults, teenagers, 20s, 30s, and occasionally beyond that. And it sometimes occurs seasonally, with peaks of this disorder seen in the spring and the fall. It is thought to be related to infection with an upper respiratory virus or another virus because it shares many characteristics with other rashes caused by infections with viruses. It can be seen in men or women, but it's slightly more common in large studies in women than men. Most folks who have this have a rash, but they otherwise don't feel ill. And it is self-limiting, meaning that after a period of time, usually several weeks or a month or two at the most, it gradually resolves on its own without any residual sequelae. Like other viral rashes, most folks are thought to only have this condition one time, and then we become relatively resistant to it. Well, what does it look like? Typically, classically, Pityriasis rosea starts with a single, larger red scaly patch called the herald patch, because it heralds the onset of the illness, heralds the onset of the rash. This patch is often 2 to as much as 10 centimeters in diameter, which is often much larger than the subsequent crops of lesions that occur. Over the following several weeks, new lesions arise, primarily in the trunk, neck, and upper extremities, although occasionally other areas can be involved. The lesions have a typical morphology or shape. They're often oval or round with a fine trailing rim of scale called a collarette. On the back and chest, these lesions can often be arranged diagonally so that, looked at from a distance, they almost look like a Christmas tree. And we have some photographs of that in a moment. There are atypical forms that can appear. For instance, sometimes this will manifest as small bumps rather than larger scaly paps or plaques, and sometimes it occurs in odd distributions. Importantly, when you consider other conditions that can produce a rash like this, the rash of syphilis can often be confused with Pityriasis rosea. That's a condition that occurs in young people as well. Of course, that's a sexually transmitted disorder. This is not. Here we have some clinical images. On the top left, you can see a young man with a rash in his chest. The larger lesion on just below the left collarbone there, and there's a close-up of it on the bottom right, that must be the herald patch. That represents the first patch that appeared and often the last patch that eventually goes away. When the rash does resolve, it often resolves in the opposite order in which it appeared. In other words, the first lesions to appear are the first ones to resolve. The bottom left, you can see a young lady with, again, oval scaly patches on her neck and upper chest. From a distance, you can see on this young lady's back that these oval lesions are arranged in a rather diagonal configuration, which looks like a Christmas tree, or is felt to look like a Christmas tree at one time. On the right, close-up of the red scaly lesions with that trailing collarette of scale. Well, what else can this look like? Again, there are many conditions that produce red scaly rashes or papulous squamous eruptions, which means red scaly rash on the trunk. And these are some of them which are beyond the scope of this discussion, but information about all of these conditions can be found here at Online Derm Clinic. Well, how do you treat this condition? Many times, no treatment is necessary at all. Doctors refer to this treatment as benign neglect, meaning you just let the condition run its own course. It doesn't make people ill. If it's not symptomatic, no treatment is mandatory. If it is symptomatic, if it itches, which is the most common complaint if one occurs, then it can be managed simply by applying topical lotions or creams that contain ingredients that make the skin feel cool or chilled, because we can't really feel itch and cool at the same time. A common example of this is called Sarna lotion, which is available over the counter. Sometimes if the lesions are quite inflammatory, topical corticosteroids of varying potency can be prescribed by your physician. Antihistamines are helpful if it's itchy. Treatment with special types of ultraviolet lights can be performed in the dermatologist's office if the condition is particularly widespread or very chronic. And an oral antiviral called acyclovir has been shown to be of some benefit in patients, especially if used within the first few days or week of the onset of the rash. Again, many patients don't need any treatment. It will resolve on its own, and most folks just need reassurance.